Hello friends, welcome to my YouTube channel Helping Hand for Nurses. In this video, I am dealing with water-soluble vitamins from the subject Nutrition and Biochemistry. Please watch the full video. If you like this video, please like and subscribe it. Let's start the video. We can see the general properties of water-soluble vitamins. These are heterogeneous group of compounds differ chemically from each other. Common thing among them is their solubility in water. These are excreted in urine and are not toxic to body. It is not stored in large quantities, hence must be continuously supplied in diet. It forms a coenzyme, which is the active form of vitamin that helps the enzymes to participate in a variety of biochemical reactions. First one is the vitamin B1 or thiamine, which is also known as anti-beriberi vitamin and antineuritic vitamin. It forms coenzyme thiamine pyrophosphate, which is essential for the metabolism of carbohydrate. It plays an important role in transmission of nerve impulse. It is required for acetylcholine synthesis and ion translocation of neural tissue. So thiamine is essential for the functioning of cardiovascular system and nervous system. The main sources include meat, fish, cereals, yeast and legumes. Recommended dietary allowance of vitamin B1 is 1.2 mg for males and 1.1 mg for females. Deficiency of vitamin B1 can lead to beriberi, also known as rice eaters disease. That is, this thiamine or vitamin B1 is removed after the rice has been polished. Beriberi can be classified into three, that is dry beriberi, wet beriberi and infantile beriberi. Dry beriberi, which is characterized by peripheral neuritis, where there is damage to a nerve, occurs and can lead to decreased muscle strength, finally leads to muscle paralysis. Wet beriberi, which is also known as cardiac beriberi, and the symptoms similar to congestive heart failure. Infantile beriberi mainly occurs in infants. In alcoholics, there is an impaired absorption of this vitamin B1 and is manifested by Wernicke encephalopathy. Next vitamin is vitamin B2 or riboflavin. The two coenzymes of vitamin B2, that is a flavin mononucleotide and flavin adenine nucleotide, which takes part in variety of cellular oxidation or metabolism. And the main sources include meat, milk and milk products, and the good sources are fish, eggs, whole grain cereals. Milling of cereals removes this vitamin B2. And the deficiency of vitamin B2 can lead to ariboflavinosis, which is characterized by angular stomatitis, chelosis, glossitis and dysaesthesia. Dysaesthesia is a disorder of the sebaceous glands marked by reddening and accumulation of greasy, flaky scales on affected areas. So the recommended dietary allowance of vitamin B2 or riboflavin is 1.3 mg for males and 1.1 mg for females. Next vitamin is vitamin B3. Vitamin B3 is also known as niacin and also known as the pellagra preventive factor of Goldberg. Joseph Goldberger and his colleagues identified that pellagra could be prevented by an improved diet, but they have not identified the specific component, that is a niacin. So it is also known as a pellagra preventive factor of Goldberg. And the coenzymes are mainly synthesized by the essential amino acid tryptophan. And the coenzymes of this vitamin B3 includes nicotinic acid and nicotinamide. 60 mg of tryptophan is equals to 1 mg of niacin. It lowers production of very low density lipoproteins, increases HDL and reduces blood triglycerides. And the sources includes meat, fish, cereals. Recommended dietary allowances is 16 mg for males and 14 mg for females. Deficiency of niacin leads to pellagra, which is characterized by dermatitis, diarrhea, dementia and finally death. and it is a disease of the maize eating population. Next vitamin is vitamin B5, which is also known as pantothenic acid. It is a part of coenzyme A, which plays an important role in energy metabolism. It is essential for the formation of ATP from the breakdown of carbohydrates, protein, fat, and alcohol. The main sources include yeast, liver, meat, milk, whole grains, and legumes. The deficiency of pantothenic acid can lead to burning feet syndrome, characterized by pain and numbness in toes, sleeplessness, and fatigue. Recommended dietary elements of vitamin B5 is 5 mg. Next water-soluble vitamin is vitamin B6, which is also known as pyridoxine, pyridoxal, or pyridoxamine. Active form is pyridoxal phosphate, which is involved in the metabolism of amino acids. The main sources include meat, egg yolk, fish, milk, wheat, corn, cabbage, roots, and tubers. Intestinal bacteria can also produce this vitamin B6. And the recommended dietary elements is 1.3 mg. And the deficiency of pyridoxamine can lead to peripheral neuritis or peripheral neuropathy, personality changes, dermatitis, and glossitis. Isoniac acid is an antagonist to pyridoxine. Isoniac acid can deactivate the pyridoxine which is available in our body. So those who are taking isoniac acid therapy, we should give them pyridoxine supplements. Otherwise, the pyridoxine deficiency can lead to peripheral neuropathy. Next vitamin is vitamin B7, which is also known as biotin, vitamin H, or anti-egg white injury factor. So anti-egg white injury factor is vitamin B7. It acts as a carrier of carbon dioxide in carboxylation reactions. And the main sources of vitamin B7 includes liver, kidney, egg yolk, milk, tomatoes, grains, etc. And the recommended dietary allowance of vitamin B7 is 30 microgram. And the deficiency can lead to dermatitis. Next vitamin is vitamin B9, also known as folic acid or folate. It is essential for synthesis of nucleic acid and blood cells in red bone marrow. And the rich sources of vitamin B9 includes green leafy vegetables, fruits, eggs, peas, liver, etc. And the deficiency of vitamin B9 can lead to megaloblastic anemia. So vitamin B9 deficiency leads to megaloblastic anemia. And the recommended dietary elements of vitamin B9 is 400 microgram per day. And in pregnancy, it is 600 microgram. Next vitamin is vitamin B12, which is also known as methylcobalamin, cyanocobalamin, or cobalamin. It is the only vitamin containing cobalt in the structure. So the vitamin containing cobalt in the structure is the vitamin B12. And the vitamin B12 is derived from the animal products such as liver, meat, fish, milk, cheese, eggs. So the people who are following a vegetarian diet should make sure that they are getting enough vitamin B12 in their diet, or they are getting any supplements of vitamin B12 in order to avoid deficiency. Intrinsic factor, it is a glycoprotein which is produced by the parietal cells in the stomach, and it is necessary for the absorption of vitamin B12 in the terminal ileum. Recommended dietary allowance of vitamin B12 is 2.4 microgram per day. And the deficiency of vitamin B12 can lead to pernicious anemia. Pernicious anemia is a megaloblastic anemia which is caused by the vitamin B12 deficiency secondary to intrinsic factor deficiency. And vitamin B12 is important for metabolism and the formation of red blood cells and the maintenance of the central nervous system. So, deficiency of vitamin B12 can lead to neurological manifestations. There will be degeneration of myelin sheath and peripheral nerves. Then there will be beefy red tongue. Beefy red tongue is a characteristic of vitamin B12 deficiency. Then Hunter's glossitis or Moehr's glossitis, which is a condition characterized by a smooth glossy tongue that is often tender or painful, caused by complete atrophy of the lingual papillae. So Hunter's glossitis or Merle's glossitis is a characteristic of vitamin B12 deficiency. Next water-soluble vitamin is vitamin C. It is also known as antioxidant vitamin, anti-hemorrhagic vitamin and anti-infective vitamin. The chemical name for vitamin C is ascorbic acid, and it was discovered in 1747 by the British physician Lind, and he demonstrated that citrus fruit juices prevent and cure scurvy. So, vitamin C was discovered by Lind, and he demonstrated that citrus fruit juices prevented and cured scurvy. It is essential for the formation of the collagen fibers in connective tissue, and thus it helps in wound healing. It is also needed for the healthy immune system and strong connective tissue. So the rich source of vitamin C includes citrus fruits and vegetables. And this vitamin C helps in the absorption of iron. Recommended dietary elements of vitamin C is 90 mg for males and 75 mg for females. Vitamin C deficiency can lead to scurvy, which is characterized by swelled and bleeding gum, skin and joint bleeding, pyorrhea, anorexia, delayed wound healing, anemia, lower extremity edema and tenderness, fatigue and weakness. The characteristic of scurvy is a corkscrew hair pattern with tiny bleeding points around the orifice of a hair follicle. Another characteristic is woody legs with large spontaneous bruises in lower extremities. This is a corkscrew hair pattern which is seen in scurvy. Excess dose of vitamin C can interfere with absorption of vitamin B12, which can cause leukosuria and promote formation of oxalate kidney stones. So excess dose of vitamin C can promote the formation of oxalate kidney stones. So that's all about water-soluble vitamins. So I hope that all of you understood the water-soluble vitamins in detail, and thank you for watching my video.